Hi everybody, welcome back for session 5 of the lifestyle programme. Tonight we are going to be focusing on sleep and intermittent fasting. Like we've said before, it's really important to us on this programme to focus on the 6 pillars of health. So it's not just about making changes to your diet. What will give you the best chance of improving your health and well-being and losing weight, improving things like diabetes and blood pressure, is to focus not only on nutrition and eating real food, but also on moving your body more, restorative sleep, managing stress, having positive social connections, relationships with your local community, friends, and also obviously reducing things like alcohol. So just a couple of things to recap on. If you missed the first of Active Devon's Move Well sessions, which were last Wednesday, the recording for that has been uploaded to YouTube. So if you didn't get a chance to join us, do watch it, because Hannah had lots of different people from the Active Devon team presenting, sort of from the behavioural change side of things to how to start. Dr. Kay Brennan answered some questions that people had to do with lack of confidence with exercise if they've got chronic pain and long-term conditions. So I'd really recommend taking a look at that. I have also sent round the slides. It was quite a big file, so I did get some people's emails sort of bouncing back at me. If you haven't received the slides and you would like them, then please email the lifestyle programme email address, which is the one that all the invites and reminders have come from, and I'll get those files across to you. So it's going to be me going through the summary of the previous sessions today, and then Ruth is going to jump in and tell us all about sleep and intermittent fasting. So all of this will hopefully be coming pretty ingrained for you all now. So sorry to repeat ourselves, but this bit is really important. So it's really important to check in with your nurse or GP, especially if you have an eating disorder, severe mental health problem, severe kidney or liver disease, and a rare genetic disorders of metabolism, any of those. Particularly important that you check in with your GP before doing this programme. Also really important to check in with your GP or clinical pharmacist if you're on any of these medications, so glycoside, insulin, any drugs ending in gliflozin, basically, and also blood pressure tablets. What's good is that over time, with a lower carb real food diet, blood pressure does drop, but that often means that you need help from a clinical pharmacist to sort of tailor your medication to that, so that you don't get any dizzy spells. So, like I said, the focus for today is going to be on time-restricted eating, intermittent fasting, and also sleep, which I'm sure we would all benefit from having more of. So just a quick recap of previous sessions. Obviously the focus has been on reducing sugar, not only sugar, but starchy carbohydrates, and we're all getting a good idea of what those are now. So things like potatoes, bread, rice, pasta. We focused on knowing our numbers, whether that be weight, waist circumference, blood pressure, blood sugar, liver function, lipids, and understanding a little bit more about those. We've had a big focus on the gut microbiome and how important that is for weight loss and overall health, whether that be physical or mental health. And then we also focused on shopping and eating out and how confusing that can be. So how much sugar should we have in our blood? Roughly 4 grams in 5 litres. That's often a lot lower than what people think that it should be. This can be quite confusing because this is the Eat Well guide that has been sort of used by the NHS for many years. But what we're learning now is that that recommended portion of sort of starchy carbohydrates probably adds up to about 250 to 300 grams of glucose. And we know a little bit more now, obviously, about the effect that has on our blood sugar levels, our weight, and overall health. So again, just a little bit of a recap on insulin resistance and what happens when there's a constant high glucose level in the blood. That obviously causes a constant high insulin demand from the pancreas, and over time, the insulin receptors in our cells become resistant. So we have starving cells, high glucose levels, high insulin levels, and then that can create its own health problems and symptoms, often increased hunger, cravings, a whole load of other things. So almost the more carbs and sugar you have, the more you want. So it's a bit of a vicious circle. We've also seen this graph quite a lot. So the blood sugar roller coaster on a high carb, ultra processed diet. It's an example of what would happen if you had a donut first thing in the morning. There's quite a sort of drastic spike there. And then of course, what comes after the spike is the big drop afterwards. And in that drop, where you get that little red bit there, you often feel quite urgently hungry when your blood sugar levels sort of drop lower like that. And then you can see what happens after a bowl of Weetabix, even if that didn't have any extra sugar on top. That's just the carbs in the Weetabix. So again, up, down, and then bananas and 2 satsumas. Often we forget how much sugar is in certain fruits, not all fruits, but particularly tropical fruits like bananas, goes up again. You get that drop afterwards where you might feel even more hungry. And then beans on wholemeal toast, so you can just see the up, down, up, down. By comparison, this is a smooth blood sugar level on a real food, lower carbohydrate diet, insulin turned down, less hunger, and able to burn fat. So lots of people report reduced levels of hunger on a real food, lower carbohydrate diet. They do still get hungry and know when they need to eat, but it's not so urgent. You don't get that hanger that I know lots of people will know well. We've talked a lot also about visceral fat and how a real food, lower carbohydrate diet can help to reduce that. So on the left there, is a healthy liver, and then we have fatty liver there on the right and on the bottom. Obviously, what helps to reduce this visceral fat on our organs is by trying to reduce insulin resistance, so becoming more insulin sensitive again, and looking after our overall metabolic health. Another thing that we focused on a lot throughout the program is the gut microbiome, and how there are 100 trillion microbes living in our guts, and how much of an impact that can have on our overall physical and mental health. And we've learned about what foods are good for that bacteria, what makes them thrive, and what foods aren't so good. So in terms of the gut microbiome, we know through research now that it can affect our blood sugar response to the foods we eat, how we handle lipids, our hunger levels, weight gain, and of course can also impact blood sugar levels and diabetes. So how can I improve my microbiome? Avoiding sugar, avoiding processed foods, including emulsifiers, preservatives, and artificial sweeteners, and limiting the use of antibiotics. Obviously, you really need antibiotics. We wouldn't recommend that you don't take them, but they are known to have an effect on the gut microbiome. Lots of people like to take a probiotic after antibiotics just to try and repopulate that good bacteria. So good foods to boost your microbiome: full fat yogurt, kefir, which is basically super yogurt with 5 times the normal amount of microbes, kombucha, fermented tea. Obviously keeping an eye out, there are lots of different types of this, and quite a few of them in the supermarket will have sort of added sugar and flavourings in them. Sauerkraut and kimchi as well, also really good. More foods to boost your microbiome. So lots of fibre to fuel your microbes, trying to have as many different colours of veg as you can, green veg, artichokes, onions, garlic, leeks, coffee. It's really good for your microbiome. Peanuts, obviously being careful with nuts, that they can be quite calorie dense. So if your goal is to lose weight, obviously it's best to sort of look at your portions of those. A little bit of red wine, olive oil, dark chocolate, and foods, basically foods that are high in polyphenols, which are antioxidants. So in our shopping session, we focused on how to watch out for all the different types of sugar, all the different disguises. So how it might be listed on ingredients lists on the foods we pick up in the shop. Lots of different names, but all ultimately sugar. And summarising sort of the different categories of foods. So we've got here the carbohydrate content of real foods, all the ones that are low, between 0 to 10 grams of carbs per 100 grams. So we've got things like fish, eggs, olive oil, certain fruits like strawberries, melon, and milk. The medium section, so these foods have between 11 and 20 grams of carbs per 100 grams. Things like apples, kiwis, cherries, but then also your vegetarian sources of protein, like lentils and beans. And then the high carb section of real foods. So the potatoes, things like potatoes and bananas have between 20 and 25 grams of carbs per 100 grams. And you've got the very high rice and bread, and then the carbohydrate content of fake foods as well. So things like pancakes, especially when they're shop bought, bakery items, ice creams, things like that. And this is just the label of gluten-free bread, just to show that it is still sort of quite high in carbohydrates. And it's always good to just have a look at all of the ingredients in there. Much lower, something like kimchi, so not only low in carbs, but really good for your gut microbiome. I know Ruth mentioned the Actimels and other immune support drinks in previous sessions. And on the packet, it says they are really good for your gut microbiome. But what is in there is quite a lot of carbs and also sugar, liquid sugar, which we know isn't good for your gut microbiome. Much better super yogurt, kefir, particularly the plain types, quite low in carbs, and this one has 14 strains of live cultures, along with just organic British milk. So yeah, much less ingredients. This is just an example of a peak in blood sugar after having a McDonald's meal like this. I think that might be chocolate milkshake, fries, and a burger. So this person's blood sugar peaked at 12.3, which is quite high. So just a summary: to watch out for hidden sugars and other additives, look after your microbes and they will look after you. Don't be afraid to ask for something that's not on the menu. If you're in a restaurant, that might be asking to switch out potatoes or chips for a salad. And also to consider fasting on journeys if that is safe for you. So not if you're on certain diabetes medications. Yeah, but we will focus on that more in this session and who has to take extra care with that. So I'm going to hand over to Ruth now.
So, time restricted eating, or sometimes you hear it called time restricted feeding or intermittent fasting. So, what is it? Can it help if I'm trying to lose weight and improve my metabolic health? How do I get started? And what are the risks? Okay, sorry about this curve. There's going to be a few curves in tonight's session. So, this basically looks at your insulin being released from your pancreas. Right, so if you look at, so can you see my arrow? So there's an yeah, great. So there's an arrow there pointing to your first spike of insulin of the day. So if you have that breakfast that we've looked at before, you know, the bran flakes, the apple juice, the wholemeal toast. If you have that breakfast, that's a big sugar stroke carbohydrate load, and your pancreas fires out a huge amount of insulin to deal with it. And then as your blood sugars drift down because of that insulin, your levels then drop down. And then you can see there's a little spike there about 10 o'clock. So I'm presuming that person then was a bit hungry and had a biscuit or two. And then as the sugar drifts down, the insulin drifts down as well. And then look, lunch. I wonder what they had for lunch. Definitely something like sandwiches, like I'm guessing. Pasty, could have been a pasty. And then it starts to drift down again. And then look, another spike. So 3 o'clock, that person had a sugar slump, felt like they were hungry, needed something to boost their sugar. This is the blood sugar roller coaster. And so they had something else, something again, carby or sugary. So a biscuit again, or a cake, or piece of toast. And then it starts to drift down, and then bang, look at that evening meal. That was clearly jacket potatoes, pizza, steak pies, all those things with lots of carbs, maybe a pudding as well. And then the insulin starts to drift down, goes back up again. Look, that person is watching TV and tucking into either an Ovaltine or some chocolate or some biscuits again. And then it starts to drift down. And you can see by midnight, because they've not had anything else, by midnight it's drifted down nicely anyway. And then this one basically shows that if you're so this is fat burning. This is how well you're fat burning along here, and this is the time elapsed since your last meal. So say this is your 8 o'clock evening meal here. You can see that your fat burning is not going to get going until about 12 hours after you've eaten anything, after you've eaten something. So if that's 8 o'clock when you have your evening meal, and that's 8 o'clock in the morning when you have your breakfast, you can see that actually if you ate there, then you wouldn't then go into fat burning. But if you fasted there, fat burning really takes off from about 12 hours. And you can see between 12 hours and what's that, about 20 hours, you're really getting a good bang for your buck in terms of your fat burning. And this just shows, there you go, at 7 or 8 o'clock, you have that breakfast I described a minute ago, and your fat burning then disappears. It goes off a cliff. So you're actually in fat storage mode then. But this is where you would like to be. You don't have to go all the way up there, but if you can get a little bit up that curve, actually burning your fat, that would be much, much better for you. And I find this quite helpful because you sometimes have couples who change their diet and they do exactly the same thing pretty much. But sometimes it's the woman, often it's the woman says, my husband's lost 3 stone and I just can't shift it. And I suspect it's probably because she's been having Ovaltines in the evening or chocolate in the evening or maybe a snack in the middle of the night if she's not sleeping. So try and get, beyond that 12 hours of sort of eating. Okay, so I've shown you that one. And the reason why I've then drawn a red one on top is to show that at the end of the day, if your insulin levels are still quite low, they haven't had a chance to drop, the next day you'll be starting at a higher level of insulin. And that will just go up and up and up. And then probably at the end of that day as well, your insulin levels will be a bit higher. And that basically leads to this condition called hyperinsulinemia. And it goes hand in hand with something called insulin resistance. So if we're insulin resistant, that's why we can't exercise very easily, because if we're insulin resistant, we can't actually access that sugar very effectively that's going around in our blood. We just can't get it into the muscles as easily. So that's why when people change their diet first and reduce their insulin and make themselves more insulin sensitive, that's when they are able to start exercising more comfortably. I just need to move this out of the way. Right. So, and we know that if you've got constantly high insulin levels, you'll be hungry, you'll be gaining weight, and that's both subcutaneous, so under the skin, and the visceral fat. You'll be insulin resistant and unable to exercise. And all of that leads to prediabetes, type 2 diabetes, inflammation. So often people are inflamed. And if ever you've had your bloods checked and someone says, oh, your CRP, your inflammation marker is up a bit, that's a really common situation. So throughout the body, there's this inflammatory process going on if we've been having sort of constantly high insulin levels. And we know that this can contribute to heart disease, kidney disease, dementia, and some cancers. So I've got a family history of dementia, so that's my motivating factor for wanting to keep my insulin levels low. I'm hopeful that that might reduce my risk of getting dementia later. Okay. So how effective is it? And I'm sorry, I wasn't able to find it. Somebody posted something about how is there actually any evidence for intermittent fasting? There definitely is. Obviously, there will always be counter evidence as well. And I think I mentioned that last time. Um, but like, a bit like eggs. Some weeks eggs are in the Daily Mail as being good for you, and some weeks they're bad for you, and then they're back to good for you again. So, but overall, there's really good evidence that time restricted eating or intermittent fasting are really effective, just as effective as bariatric surgery. I mean, we know that bariatric surgery works well. Sadly, it doesn't always last. I've got some patients who put the weight back on again after their bariatric surgery, but intermittent fasting definitely works. And what's so appealing about it is that this isn't something strange, far-fetched, dangerous in most people, because it's exactly what we've evolved to do. It's what our ancestors did. So our ancestors were definitely not 3 meals a day plus 3 or 4 snacks a day. They would have gone for long periods of time between their meals. They certainly wouldn't have been snacking on biscuits and sweets and fizzy drinks. And as we've said, we cannot burn our fat stores if our insulin levels are high. Um, and then that final point, fat burning is better the longer we go between eating. Sorry, I've got a cold at the moment. I'm on the verge of sneezing, so excuse me if I do. So here are the benefits of the intermittent fasting. So improved insulin sensitivity, we've talked about. It rests our pancreas. So we know that, certain cancers are more common in people who are overweight, type 2 diabetic, and pancreatic cancer and bowel cancer, womb cancer. They're the ones that it really are the ones that sort of stand out, breast cancer as well. So if you rest your pancreas, and also reduce your inflammation, which we've talked about, that will reduce your risk of getting some of those cancers. This IGF-1, this is a hormone, and we know that when IGF-1 is elevated, that does increase your risk of getting these age-related diseases, including cancer. And we know that intermittent fasting reduces the IGF-1. We also know that it switches on our repair genes. So our body has always, there's always this turnover of cells. And actually, we really want that turnover of cells to be very effective. We want to be mopping up the damaged DNA, because if we don't, that will again increase our risk of developing cancers. And then I love this one at the bottom. It actually improves our mood and well-being as well, and alertness. So if you're fasting, what can you have? So basically, it's anything that doesn't spike your insulin. So plain water or sparkling water, tea or coffee, ideally black. So a tiny splash of cream is probably okay, but definitely no sugar and not half in half milk and water. Um, Definitely no sugars or sweeteners. I don't know if anyone's got into bone broth, but I know some people really use bone broth quite frequently. Um, it's really important that you stay hydrated though. So aim for 2 to 4 liters of water per day if you're fasting, mainly water, and keep your salt levels up. And these are the main options. So the 5-2, we'll come back to that in a bit more detail in a minute. Time restricted eating, which is yeah, we'll come back to that as well, but that's what I sort of practice, and it's just very kind of in keeping with our evolution. Alternate day fasting, and then extended fasts. So this is the 5-2. So this is a really common one. So Michael Mosley promoted this one. So basically, for 2 days of the week, you're restricting your calorie intake to 800. And then on the 5 days, you're just eating sort of normally. Although I would really encourage you, if you're going to do this, please don't undo all the good that you've done on those 2 days by eating junk on the 5 days. So eat a healthy Mediterranean style diet, still avoiding the junk food. Okay, so the pros, it's very effective for weight loss. I know some friends who've done really well doing this, have lost quite a lot of weight. It's the dietary restriction is only 2 days a week, so that might be very sustainable, very appealing for some people. Um, and if you've got, like me, if you have a couple of really busy days at work, that would be potentially your 2 days for restricting because you don't have time to eat anyway. And then the cons, you're back to calorie counting again. And I know lots of people don't like calorie counting. And then this is a really important one for me, is the risk of deficiency in protein and the micronutrients on your fast days. So if you're going to do this, please make sure that you're not miles off your protein target on those days. And it's not suitable for everyone, certainly not for people who are on diabetes medications, because they could be having sort of dangerous swings in blood sugars. Okay, right. So this is time restricted eating. Yeah, right. So this is what I do. So this is basically involves respecting an eating window rather than continuously grazing. And that eating window duration can be increased over time. So if you look in this bottom left-hand corner, this is what I used to do. So breakfast at 7 o'clock, which was probably shredded wheat, Weetabix or porridge, thinking I was being healthy. And then I'd be starving hungry by 11 o'clock and I'd have a good two or three biscuits. Lunch at 1 was definitely a sandwich, maybe crisps. Biscuits because I was starving hungry again by 4 p.m. 9 o'clock dinner if I was working late, and then I might be hungry again and eating snacks in front of the telly. So that eating window is 16 hours, and I was only fasting for 8 hours. So what you can do is you can extend your fasting window to 14 hours and reduce your eating window to 10 hours by delaying your breakfast to 10 o'clock, bringing forward your evening meal, so finishing at 8 o'clock, and definitely avoiding snacking after evening meal. Um, Yeah, so there you go. So that's that curve we were looking at earlier. So as we said before, if you get to that 12-12, say you're eating in a 12-hour window and you're fasting in the other 12-hour window, um, your fat burning is literally only just about to get going then. So don't scupper it by having something to eat. So and if you can get up to this point here where it's 18-6, so 16 hours of fasting and an 8-hour eating window, you can see you'll be doing really well with your fat burning there. So who shouldn't fast? So I've put there pregnant ladies, but I actually don't think that pregnant ladies should be continuously grazing either, because we do have an epidemic of gestational diabetes, and I'm sure that pregnant ladies would do well to not be grazing all the time and eating really, really high carb, high sugar processed foods. Having said that, I don't think they should be doing severe, sort of extended fasts or the 5-2. That wouldn't be appropriate either. They probably do need to be eating at least two and possibly three meals a day. So people who are on diabetes or blood pressure medication, we talked about people who are underweight, people with anorexia nervosa. These are people who really shouldn't be fasting, I don't think. And there's loads of stuff on the internet, on YouTube, but these are a couple of books that I've come across, which are, got a nice guide to fasting. And now sleep. How cute is that little guy? Right. And the reason I lump sleep in with intermittent fasting is because, as you probably gathered, they're definitely connected, aren't they? So, why is sleep important? How much do we need? We're going to talk about sleeping pills and alcohol, I'm afraid, and then tips how to improve your sleep. Who hasn't done that or something similar? We've all been sleep deprived at some point, done something really stupid and kicked ourselves for it. And I wonder if any of you already know about this guy. So this guy is the absolute guru of sleep medicine. So he's Dr. Matthew Walker. He's a um, consultant scientist and is he, no, he's not a medical doctor, but he does treat people with insomnia. And he works in California, but he's from Liverpool in the UK originally. And he is a very interesting man for you to get into. And this is his TED Talk, which basically starts talking about testicles. If there are any gentlemen on the call, you might be interested to know that actually men who are sleep deprived have smaller testicles and lower levels of circulating testosterone than men who are well slept. But it doesn't stop there, of course. So we know that really important functions happen while we're asleep, including laying down of memories, learning new things, and then getting rid of. So this basically is a bit to illustrate how important a good night's sleep is to reduce our risk of getting infections and cancers. Because this blob here on the left, this is called a natural killer cell, and it's a really, really important part of our immune system. And basically, if we are well slept, we have more of these than if we are poorly slept. And that curve on the right shows that in a study that he did, he sleep deprived people I can't, oh gosh, I'm having to move this thing around again. Sleep deprived people to 4 hours of sleep. And he noticed that those subjects actually had 70% less natural killer cells. So that is, as he says in this talk, a very worrying state of immunodeficiency. So why would we deliberately do that to ourselves? So why is sleep important? Here we go. Big long list. It makes us feel more energetic. It helps improve our concentration. We're able to learn better. We're able to make better food choices. So if I'm really tired, if I've had several nights sleep in a row, several poor nights sleep in a row, then I'm definitely feeling more hungry and prone to, not making the best food choices. Our immune system we talked about, and then this thing, autophagy or cellular cleansing. So that's part of that process of preventing sort of cancers. Is having your body is very clever at clearing up broken DNA, broken cells, but actually it doesn't do it so well if we're sleep deprived. So we know there's a link to poor memory and indeed to Alzheimer's. We know that there's sleep. If we're well slept, we improve our life expectancy. We reduce our risk of being overweight, reduce our stress levels, reduce our risk of developing dementia and all those chronic diseases. And then sadly, the opposite is true. If we're lacking in sleep, we are sort of increasing our chances of getting all those. So how much do we need? Everyone is different. But when people say, I only need 4 hours, I'm fine on 4 hours, there are some people that can get by on 4 hours, but they're really, really rare. So generally, if someone says that to you, they're kidding themselves, I'm afraid. And I'm not trying to be mean because I'm going to show you hopefully how to improve your sleep if that is you. But let's not be in denial about it. Let's if we are only getting 4 or 5 hours sleep every night, let's at least try and correct it. So on average, most people need 7 to 9 hours. Um, you may know how much you need. I mean, I thought I was a 7 hour a night girl, but actually it turns out I'm more of an eight and a half. And yeah, you won't know until you try pushing it up and see what actually suits you better, makes you feel better. Regularity is really important. So this is one of Matthew Walker's things. Try and aim to be at the same to aim for the same bed and wake time throughout the week. Avoid this thing called social jet lag, where during the week we're up at 6:37 and in bed by 10:30, and then during the weekend we've shifted that whole system by about 2 or 3 hours. So try to avoid that if you can. Of course, from time to time we can't avoid it. Aim for good quality sleep. And the reason I'm sort of emphasizing that is because people say, oh no, I'm fine with alcohol, I'm fine with coffee, it doesn't stop me sleeping. But actually, we know that people who do drink coffee and do drink alcohol and do have sleeping tablets, they're not having good quality sleep. They're knocking themselves out, but they're not having those really, really important restorative functions that happen when you're in proper deep sleep. And then there's this thing about respecting your chronotype. So your chronotype is whether you're a night owl or a morning lark. So if you are a night owl, don't try and make yourself a morning lark or the other way around, unless of course you can't avoid it. Already mentioned those, haven't I? So when we're asleep in proper sleep, there's some incredible magic that happens, some flushing out of the brain of this beta amyloid that when it's allowed to build up can contribute to Alzheimer's. There's all those other things, the natural killer cells we talked about. And if we take sleeping pills, and I'm not trying to pass judgment because I know that some people unavoidably end up taking them sometimes, particularly if they're grieving or whatever. But if we're taking the sleeping pills, we are just knocking ourselves out. We're not actually benefiting from a good night's sleep. So his top tips, Matthew Walker. Here we go. The regularity. So try and get up every morning at the same time and go to bed every night at the same time. Your temperature is really important. So to get a good night's sleep, we actually need to cool down. Our bodies need to cool down. So if we try and sleep in a really warm room, then you are less likely to get off to sleep and have a good night's sleep. So apparently the ideal temperature is 19 degrees if you're interested. So keep it dark, dim the lights, particularly an hour before bed. Avoid technology if you can, a bit of telly, but with lamps on. Wear blue light glasses if you need to, but generally avoid being on your phone, avoid being on your laptop. Try and do some knitting or listen to something on the radio or whatever. But yeah, try and avoid technology. Don't remain in bed awake. So what you don't want is if you're, and we'll come to 3 a.m. awakenings in a minute. But if you're lying there in bed at night and you've tried to get back to sleep and you just can't, the best thing is for you to get up, leave that room, go and sit quietly in another room that's dimly lit and read a book or do some knitting or something. Definitely don't have anything to eat or drink. Go for a wee if you like. And then eventually when you're feeling sleepy, then get back into bed again. And the reason for that is because you don't want to associate your bed and your bedroom with the trauma of lying there not being able to sleep, because that then ends up being a bit of a self-fulfilling prophecy. And then caffeine and alcohol we talked about. So caffeine, even if you have a cup of coffee or caffeinated tea at 12 o'clock, some of that is still going to be around in your blood at 12 o'clock at night. So, and it absolutely will impair your sleep. Here's some other tips. So exposure to daylight during the day. So one really helpful thing is you get up in the morning and you go straight outside, and you look up and enjoy the natural light and let it stimulate the back of the eye. And that's a really useful way of sort of setting that really important cascade of processes that happen sort of during the day, involving the different sort of sleep hormones and chemicals that will culminate in you having a good night's sleep that night. Correct your nature deficiency. Again, that can be very, very powerful for improving your sleep. Incorporate movement, so try and be active during the day as well. Although this is quite important, if you are going to be active, doing some exercise or going for a walk, it's actually better if you can manage to do it earlier in the day rather than at bedtime. And that's because, as I said before, if your core body temperature rises at bedtime, that will sort of go against you for getting a good night's sleep. So better to exercise earlier on in the day. And then practice meditation. And I wonder whether any of you do that, but that can be really, really helpful for improving your sleep. I wonder if any of you get this 3 a.m. awakenings. The reason I put this slide in is last year people were asking about this. There were a few people who said, "Oh, what is the reason for that? And what can I do about it?" So these are the sort of thoughts about why the 3 a.m. awakenings sort of happen. So, as I said, our core temperature really important, and we know that naturally, I said these important processes that happen during the day and the evening, that can sort of contribute to whether we have a good sleep or a bad sleep. So, our core temperature starts to drop naturally from about 10:30, and that triggers melatonin. I don't know if any of you have ever taken melatonin as a supplement to help with sleep, but melatonin is obviously the natural sleep hormone. So, and if a drop in your core temperature stimulates your melatonin, that is obviously a good thing. But then while we're asleep, our core temperature sometimes starts to rise, often starts to rise in the second half of the night, usually around 3 a.m. So that's one of the reasons why it's a good idea to sleep in a cool room, and avoid being over swaddled in, really thick duvets and blankets and things and thick pajamas, because actually you don't want to be sort of adding to that. And then there's this neurotransmitter, this chemical called adenosine. So this is a chemical that starts out low in the morning and then gradually it increases during the day. And it's the sleep pressure neurotransmitter. And you want your adenosine levels to be nice and high at bedtime, because that, coupled with a high melatonin, is what helps us to sleep. Coffee, by the way, stops adenosine from working. It pauses it, puts a brake on adenosine. So that's why coffee is not good at bedtime, because you really want your adenosine levels to be nice and high at bedtime. But back to the 3 a.m. awakenings, adenosine, it's highest at bedtime. And then in the beginning of the night, the body is very cleverly sort of removing it. So that can sometimes trigger us to wake up because the adenosine levels are falling. When we're awake at 3 a.m., we end up clock watching, ruminating, catastrophizing. Things that don't seem important during the day are incredibly important at 3 o'clock in the morning. And looking at the clock definitely makes it worse. And the brain starts to learn that 3 o'clock is the time when you want to be awake. That's why I mentioned breaking that cycle. So how do we deal with them? So there's lots of different techniques, and I'll share some resources, so that you can really get into this if this is relevant to you. But box breathing is an interesting one. I've not tried that, but I know some people who find that helpful. Guided meditation. So headspace.com does guided meditation. I quite like this body scan. So you start either at your toes or at the top of your head, and you concentrate on sort of relaxing all your muscles all the way down your body and really spend a good few minutes on each one. Just it's a type of meditation, a type of distraction. But this is my favorite. Take a mental walk. So I do this almost every single night and it works for me every time. And it basically, so Matt Walker talks about how he imagines himself, sort of getting up, going downstairs, making a coffee, saying good morning to the dog, getting the lead in the right hand, opening the door with the left hand, taking the dog, going for his walk, and then he imagines each and every part of that walk. And as I said, I do this, a slightly different version of it, and I'm asleep before I've even got downstairs to make the hot drink. So it really, really works. I'd really encourage you to have a go at that. And then this other thing about not stressing for how long you're going to be awake for. Sometimes we all have bad night's sleep. So just accept that maybe tonight isn't the night for a good night's sleep, and just try and learn from it and mitigate it and do what you can the next day to increase your chances of getting a better night's sleep. Yep, stop stressing. You're more likely to fall asleep if you've stopped stressing about it. Definitely don't check your phone. Don't go to the kitchen. And then, as I said, if you can't get back to sleep, just get up, sit in a dimly lit room, or just lie there and relax and just accept that at least you're relaxing. So that's Matt Walker's book and his YouTube thing. 32,000 people thought that was good. So you might want to have a look at that. And then I love his podcasts. He's got so many podcasts. But yeah, look, you could really get into this. They're nice short ones, so I find them useful to listen to in the car sometimes if I'm doing housework. But yeah, there's all sorts of different interesting podcasts. And then this is a bit of a one-stop shop for me. I could really encourage any of you who struggle with your sleep to go over to the New Forest Primary Care Network website. They've got loads of good resources about diet, about type 2 diabetes, about reducing your carbs. But this page I use this all the time, so about sleep. And some of the really important Matthew Walker things are on there. And then this one as well. So this is from Aspen Medical, which is a GP surgery in Gloucestershire. And this particular website, they've called it eatrealfood.uk. And they've got some really interesting information on there, including some stuff on sleep. So that was a GP called Sam Kwok who's produced that, and I've borrowed some of her slides for tonight's session. And then while I'm signposting, I just had to put that one. I'm hoping that you all know about that by now, the Freshwell resources. Okay, so just the last couple of slides just with resources. So Calm is a good one. Headspace is a good one. And this is Silver Cloud, which is free to patients in our Torridge network. We've sort of invested in that apparently, and that's how you get hold of that. I might get Sophie to answer this one, how you access it, whether you need a code or something for it. Sophie, do you know?
I'm just looking into it as we speak. Yeah.
Wonderful. And there's another one that you're going to tell me I've forgotten again. But that's my final slide. Just enjoy your sleep and prioritize your sleep. And there are so many things that distract us from having a good night's sleep, aren't there? And I'm definitely guilty of this from time to time. So I'm not trying to judge you, but if you can try and prioritize it, then you may find that you absolutely reap the rewards, short and long term. Stop sharing.
So having briefly looked at it, it looks like you can self-refer. I'll put the link on the chat. The only other thing that was available, but it isn't anymore, is Sleep Station. I've just been checking
Yeah.
all the Torridge surgeries on their website, and it doesn't look like it's commissioned anymore
Okay, that's
for the
gone.
Torridge surgeries.
Silver
But
Cloud is still available though, is it?
Silver Cloud is, and there's another app called Sleepio, which can be really good. It's not available through any of the local surgeries here, but you can download it. I think it is reasonably low cost, but I know that's approved by NICE as well.
Absolutely. Yeah, good shout. Sleepio. It's a really good one. I feel like there was something else as well. Can't remember.
I've posted a link to TalkWorks do
That was
some
it. Yeah.
sleep workshops, which I spoke to a patient the other day actually who had been to that, and she found it really helpful because I don't think you acknowledge when you're struggling with sleep actually how much you're thinking about sleep is part of the problem. So those workshops, they're not just about sleep hygiene, or like all of the things that you were talking about, body temperature, not having caffeine, but also addressing the negative thinking about sleep and how that sort of feeds the problem.
Absolutely. CBTI, isn't it?
Yes, yeah.
Yeah,
And they're
absolutely.
really easy. I think they're really easy to access whenever you're free. But yeah, I also second the Matt Walker podcast. An extra bonus is that he has a really relaxing voice.
He does, yeah.
So I have actually fallen asleep listening to his podcast before. So he did the job.
Absolutely lovely. He's a really humble man, isn't he? Very
Yeah,
successful, very, very humble.
yeah.
Um, Yeah, no, that's a good shout about TalkWorks. So TalkWorks, sorry, slightly going off at a tangent. If there's anybody struggling with menopause symptoms, TalkWorks do
Mhm.
a menopause workshop as well from time to time. And again, it's CBT, so it's about trying to sort of get rid of those negative thoughts and channel them into sort of positive ones. Um, so yeah, so
Mm.
that can be good. And sorry, also while on menopause, if anybody is on HRT, there's it's a really important thing. If you're taking your estrogen and your progesterone, because that's usually how people take HRT, the progesterone part of it, certainly one called Utrogestan, is better taken at night time. So if anyone is on that tablet but is taking it in the morning, taking it in the evening can be actually really helpful. And taking the estrogen, if you're on an estrogen gel, taking that in the morning because estrogen perks us up and progesterone helps us to sleep, apparently.
And generally as well, TalkWorks. Um, I mean, CBT is brilliant, isn't it? For if you're struggling with the impact that any long-term condition has on your
Mm.
ability to do the things you like. I know they help a lot of people who've got COPD, chronic
Yeah,
pain, just to help with the thinking about the pain or what you can't do.
yeah, absolutely.